I really am pleased to be here, and you know, I've been fortunate and challenged, of course, in my time in public life. The challenges of ministerial office at any time come with real compromises on your time, what you can do outside of work, time with family, but also it gives you an opportunity to do things. And you know, I always knew that being the health minister was a big challenge, and then the last 18 months, 2 years have been an extraordinary challenge that we'd often thought might happen. There might be a global pandemic of some kind. It was in the risk register, but then to have to live through it, to see it to be not just a global pandemic, but actually a once in a century event has been something else as well. And yet now there's a new challenge in terms of rebuilding the economy after the pandemic is finally over. And I actually think that rather than reducing the importance of diversity and cultural awareness, I think it's highlighted those things as well, because we think about the harm that COVID has caused, think of the challenges we now face. We know that actually the less well off you are, the more likely you are to have poor health. We knew that a long time ago. We also know that Black and Asian origin communities are more likely to be concentrated in those communities and families. We know that multi-generational living has been a real challenge and a real factor in COVID harm as well. We know that Black and Asian origin families are more likely to live in multi-generational households as well. So the harm that COVID has caused hasn't been evenly spread across our country and our society. And yet, so they're the challenge on how people access services that understand who they are and understand the particular challenges, and to make sure that we know that this isn't just a physical health issue, this is very much about the general mental health and well-being harm that's been caused and what that means for the future. Now, I think that provides an opportunity as well to look again at what we have done and we can be proud of having done, not just in this last couple of years, but actually in a broader period of time in making some progress. And, you know, the statute of Betty Campbell is part of that, some recognition that we exist, recognition that women exist and have significant achievements, recognition that Black people exist and have significant achievements as well. And Betty was a real person. You know, she wasn't a comic book hero who is perfect in every way. She was a real person with feelings and thoughts. And, you know, she mattered when lots of Black people didn't matter. The challenge now is how do we make sure that Betty's experience living her life isn't the one that people live today? How do we make sure that whether it's business or it's a public service, that people say this person in front of me matters and I need to understand more about them to deliver the sort of service, the care that I would want for me and my family. And actually, having launched the first cultural competence framework with Diverse Cymru and with Suzanne, I'm really pleased to see the continuation of this and the partnership with the Royal College as well, to recognise that diversity isn't just something for lefty liberals or to be dismissed as being woke. It actually matters for all of us. And in my new role, I had a really interesting conversation with one of the Welsh envoys in the United States. He's running a tech company in California, and his mum and dad live in Bridgend, County Borough. And he said they were delighted to get their vaccine and to get it on time. They were very positive about the government. Actually, he was making a point that in America, diversity really matters. He was saying in the tech business in California, this isn't just about doing it because it's a nice thing to have on your CV. It really matters about who you get, about the talent you have, about the talent you will miss, and needing to understand the communities where you can draw that talent from, as well as the community who will be your customers. And so this is a very real thing. And he was making the point that actually having a headline minister who looks like me is a real positive and a strength in our relationship. But I was really struck by the way that he took it as a given that this would matter, and it should matter. And you know, if you think it matters, then how do you understand how to do it properly? How to make sure you're not making mistakes you don't have to, and how to learn from those things as well. And I think one of the things about the competence framework is it's not about judging people, not saying because you didn't know this, you are a bad person. It is about how do you improve? How do you get to grow what you can do in a way that is genuinely positive? And I think that gives us real strength, because we still live in a time, a challenge. but we also still live in a time of real opportunity. And that's what I want to focus on. How do we get to do things better for each and every one of us? Because we may have different histories, but we absolutely have a shared future and a shared interest in all making progress together. So I'm really pleased to be able to be here in person to say a few words. I hope Suzanne's going to say really nice things about me now I'm finished as well. But you know, I look forward to seeing the outcome of this, and to seeing how many people have gone through the not just getting certificates, but then seeing what has changed about the way people undertake their practice, and to be able to say, are we now in a better position? And I'm really confident that people will be able to tell that story. So thank you very much for some time this morning. Really pleased to be here on a screen. I look forward to seeing you in person when we finally exit the times we're living through and get back to what the new normal is, and our opportunity to shape what the new normal really should be. Many thanks.